So, you're trying to figure out what's going on with your gut. And let's be honest, it feels like you're lost in a maze. It can be so confusing, really frustrating, and just overwhelming. But what if you had a clear map? Well, that's what we're doing today. We're going to break down the entire diagnostic process step by step so you know exactly what to expect on the journey to getting some real answers.
That abdominal pain, the bloating, that feeling like your digestive system just has a mind of its own? Yeah. If that sounds familiar, you are so not alone. These are the classic symptoms that usually kick off the whole search for answers, and we're here to help you navigate it.
So here's our game plan. First, we'll talk about why diagnosing IBS is kind of like solving a puzzle. Then, we'll get into the official criteria doctors actually use as their guide. We'll walk through what a typical doctor's appointment looks like, explain the super important step of ruling out other conditions, and then wrap up with the critical red flags you should never ever ignore.
All right, let's start the investigation. Because getting an IBS diagnosis isn't always straightforward. It really is like being a detective. All your symptoms, the pain, the bloating, the unpredictability, those are all clues. And the goal is to piece them all together to see the bigger picture of what's going on.
Okay, this is probably the most important thing to understand right from the get-go. Unlike a lot of other conditions, there's no single blood test, no scan, no procedure that can just say, yep, you've got IBS. It's what's called a diagnosis of exclusion. And that's really just a way of saying it's identified by your specific pattern of symptoms after your doctor makes sure it isn't something else.
So if there isn't one single test, how in the world do doctors diagnose this? Well, they follow a very specific set of guidelines. These are the official clues, the rule book that helps them identify the distinct pattern of IBS. Let's take a look at what those are.
This is it. It's called the Rome 4 criteria, and you can think of it as the gold standard. It's basically a universal checklist that doctors all over the world use, and it's all about pinpointing a very specific pattern of digestive issues.
And you know what? The criteria are actually pretty straightforward. Step 1, you have to have recurrent abdominal pain, so it can't just be a one-time thing. Step 2, that pain needs to be connected to your bowel movements in at least 2 ways. Either it's related to when you go, it's linked to a change in how often you go, or it's tied to a change in what your stool actually looks like.
And here's the crucial time component. For it to count, this pattern of symptoms needs to be pretty consistent. We're talking about having these issues on at least 3 days a month over the last 3 months. This is what really helps distinguish IBS from, say, a temporary stomach bug or just a bad reaction to one meal. Okay, let's move on to the doctor's appointment itself. This is where you bring all your clues to the table. Think of it as a team effort. You bring your story and your history, and the doctor adds their physical examination to build the full case. You're probably thinking, okay, what do I need to be ready for? Well, a huge part of the appointment is simply talking. Your doctor is trying to get a complete picture of your health. They'll ask about your family's health history, since things like IBD or celiac can run in families. They'll definitely want to know about your diet, any recent infections, and any medications you're taking. And they'll also ask about stress. This is a big one because of the powerful gut-brain connection. It's a two-way street where stress can physically mess with your digestion and vice versa. Being ready to talk about these things can make your appointment so much more productive. So after all that talking, your doctor will most likely do a physical exam. And again, the point here isn't to find IBS, but to look for any physical signs or clues that might point to a different reason for your symptoms. So what does that actually involve? Well, it's pretty standard stuff. A doctor will listen to the sounds your abdomen is making, gently feel around for any bloating or swelling, and maybe tap to find any tender spots. In some cases, a digital rectal exam might be done just to check for any abnormalities. It's all part of that thorough detective work. Now, here's a really key point. If your symptoms perfectly match those Rome criteria, and your physical exam comes back totally normal, a doctor can often confidently diagnose IBS right then and there. But in some cases, they'll want to run a few tests, just to eliminate other suspects, other conditions that can have very similar symptoms. This funnel here shows the process perfectly. You see, the tests a doctor might order aren't designed to find IBS. They're designed to rule out things like celiac disease, infections, or inflammatory bowel disease. An IBS diagnosis is what you're left with after those other possibilities have been filtered out, making it the most likely explanation. So what kind of rule-out tests are we talking about? Well, some common ones include blood tests to check for things like inflammation or celiac disease antibodies. A stool test can look for parasites or bad bacteria.
and sometimes scopes or a breath test for something like lactose intolerance might be used to get an even clearer picture.
Now, this is so important to hear. While a colonoscopy might be needed for some people, it is absolutely not a requirement for an IBS diagnosis. These more invasive tests are really just for specific situations, especially if there are any of those concerning symptoms we mentioned. Which brings us to our final and most critical section.
Okay, we really need to talk about red flags. These are symptoms that are not typical of IBS, and they're your signal that you need to see a doctor right away to rule out anything more serious. Please pay close attention here, because these are not your typical IBS symptoms. If you ever experience bloody or black tar-like stools, significant and unplanned weight loss, or pain that's so bad it wakes you up at night, you need to see a doctor. The same goes for a fever that won't go away, new symptoms that start after you're 45, or if you have a strong family history of diseases like IBD or colon cancer. These are all signs to get checked out immediately.
I want to be crystal clear about this. While IBS itself is not life-threatening, these red flag symptoms could be pointing to something that is. Your health is priority number one. Please, do not ignore these warning signs or just brush them off.
All right, to bring this all home, let's make it super practical. The very first step in this whole process is just observation. So, I'll leave you with this question. What is one thing, just one, that you can track about your symptoms this week to be better prepared for that conversation with your doctor? Whether it's the food you eat, your stress levels, or how you're sleeping, that single piece of information could be the most important clue you bring to the investigation.